Hi, I'm Dr. Shabana Khan for the Joint Telepsychiatry Toolkit by the American Academy of Child and Adolescent Psychiatry and the American Psychiatric Association. Today I'll be discussing legal, regulatory, ethical, and reimbursement considerations specific to the practice of telepsychiatry with children and adolescents. Legal and regulatory considerations in the practice of telepsychiatry are constantly evolving, vary considerably among states, and may not always align with federal regulations. Further, there may be additional considerations for practicing telepsychiatry with children and adolescents. Prior to initiating telepsychiatry services with youth, psychiatrists should consult federal and state laws, as well as the relevant laws, regulations, and policies of their state medical licensing board and the Drug Enforcement Administration, or DEA. Legal and regulatory issues in child and adolescent telepsychiatry vary by state, and they may vary by the patient's site of service. Most states require guardian consent, written and/or verbal, for telepsychiatry services, in addition to the usual consent for care. State medical licensing boards and Medicaid policies may also have specific requirements for informed consent. Additional documentation of consent may be required to record sessions. Patients who have reached the age of majority may consent to their own telehealth treatment. Telepsychiatrists should check federal and state regulations regarding their site of practice. Informed consent includes educating children, adolescents, and their guardians of the practice of telepsychiatry, its potential benefits, risks, as well as alternatives to the proposed treatment. Federal restrictions on the prescription of certain medicines through telemedicine may complicate the practice of telepsychiatry with children. The Ryan-Haight Online Pharmacy Consumer Protection Act of 2008 was passed by Congress with the goal of expunging illegitimate or rogue online pharmacies that dispense controlled substances without patient contact or physician oversight. However, this act has inadvertently limited the legitimate practice of child and adolescent telepsychiatry. The Ryan-Haight Act currently requires that a practitioner conduct at least one in-person evaluation of the patient before prescribing a controlled medicine through telemedicine practice, including telepsychiatry. Alternatively, patients being treated by and physically located in a hospital or clinic registered with the DEA or in the presence of a DEA-registered practitioner can be prescribed a controlled substance during telepsychiatry sessions. The Act requires any practitioner issuing a prescription of a controlled substance to conduct an in-person medical evaluation prior to prescribing. These restrictions considerably dilute the value of telepsychiatry. In particular, given the number of children with attention deficit hyperactivity disorder, ADHD, that are treated during telepsychiatry practice, as well as the evidence-based indication for stimulant medication, this act has made it difficult for child and adolescent psychiatrists to practice telepsychiatry commensurate with their in-person practice. The Ryan-Haight Act is also relevant to the increasing trend towards direct-to-consumer telepsychiatry, as the home setting is not considered a site of service for prescribing controlled substances. The DEA is reportedly considering remedies to these limitations, and Congress has recently released draft discussion bills to amend the federal Ryan-Haight Act. As with in-person child and adolescent psychiatry practice, telepsychiatry services should appropriately account for patients' chronological and developmental age, and psychiatrists should comply with the ethical guidelines for the practice of child and adolescent psychiatry in the ACAP Code of Ethics. Psychiatrists must consider that reporting requirements may vary by jurisdiction and ensure that relevant personnel at the distant and originating sites are informed of reporting requirements for youth. Although most state Medicaid programs provide some degree of coverage for telepsychiatry services, there's great variation among states in the amount of coverage provided, the types of services covered, and the restrictions placed on services. In the absence of comprehensive policy for provision of telemedicine services, individual states have increasingly proposed legislative solutions to issues surrounding telepsychiatry with youth. Various states have proposed legislation to expand telepsychiatry benefits for children who live in underserved areas, provide coverage for telepsychiatry delivered into schools and child care programs, and repeal laws that mandate mileage or minimum distance requirements between the psychiatrist and the patient sites in order to receive reimbursement. Like Medicaid reimbursement, the requires for and extent of private insurance reimbursement of telemedicine vary by state. The majority of states have telehealth commercial insurance coverage laws that require private insurers to cover telemedicine services similar to in-person care. However, only a subset of these states have payment parity laws, which require insurers to pay telemedicine providers the same amount as they would if that same service were provided in person. Some states have legislation to increase private insurance reimbursement for the provision of select child and adolescent telepsychiatry services, such as the delivery of autism interventions. Telepsychiatrists should review insurance companies' policies and both federal and state regulations and legislation related to telepsychiatry. For the Telepsychiatry Toolkit, I'm Dr. Shabana Khan. Thank you for watching.